and I lost my wife to cancer, lung cancer, actually 9 years ago. So that's a little bit about me.
Thank you, Jay. Andrea.
Hi, everybody. And you can call me Andy. I'm Andy Wilson. I'm from Naples, Florida. I'm new to this group, so I'm excited to be on board. Pretty passionate about it. I also lost my husband to lung cancer. It'll be 7 years in November.
Thank you. Thank you for coming. Vinard.
Hey, good afternoon, everybody. My name is Vinard Kabler, and I'm in Morristown, New Jersey. And I've been part of the American Lung Association since 2017. I lost my mom to lung cancer in 2010. So I've been an advocate since 2017, and I'm also a Lung Force hero as well.
Thanks, Vinard. Debbie. I think you might still be on mute. No, technology is not our friend. We're hoping in 2023 it will be. Yeah.
Can't hear nothing.
That's okay. Yeah. We'll come back. Alicia.
Good morning. Alicia Morin. I live in Atascadero, California, which is between San Francisco and Los Angeles on the coast.
Great.
I've been
Thank
involved. Are you getting an echo?
I am a little bit. Yes. If folks want to go on mute, yeah, except for those talking. Yeah.
Okay. Is this better now? Sort of, maybe. I've been involved for, I don't know, 4 or 5 years. I lost my husband to lung cancer 6 years ago. I'm sorry, 11 years ago. And I am a stage 3 survivor going on, well, 5.5 years. So,
Thank you, Alicia. I think that, and then Jackie. We're gonna have, well, actually, you know, hold off on Jackie because you're gonna talk first. So hold on one second. Ty, can you introduce yourself?
Sure, yeah, Ty's here, National Director of Lung Cancer Education. I'm with the ALA. I've been with them for about 9 months. January makes 1 year. And glad to be here with everyone.
Great. And Dan?
Hey everyone, so good to see you. For those who have not met me, I am our National Director of Marketing and Communications. I've worked on Lung Force since 2016, so great to be with you today and so nice to be working with all of you.
Great, thank you. And so Jackie, I'm gonna go ahead and we'll jump into Jackie. We invited, Jackie is the Director of Program Outreach for Immerman's Angels. And we were very excited because we started our relationship with Immerman Angels because of this group. It came from direct feedback from the Lung Cancer Patient Advisory Group that, you know, the one thing that the patients felt like they needed and caregivers is they needed that support and that one-on-one support. And it was a recommendation from one of our members who said, reach out to Immerman's Angels. So I'd like to give Jackie an opportunity for a few minutes to introduce herself and talk a little bit about Immerman's Angels and kind of do a, because we partnered in 2019 and we're still going strong, but would love for you to share a little bit and have folks the opportunity to ask any questions.
Sure. Thank you so much. My pleasure to be here for sure. It's an honor to speak to y'all and meet y'all. So thank you for your time. I did put like a little presentation together. I don't know if you want to see visuals.
Sure.
Does that work? Okay. Do I just hit open share tray? Is that how that works?
Yeah, you can put the share. Yeah. And Debbie, I think you were able to rejoin. I'll let Debbie introduce herself while Jackie's starting to share.
Can you see though?
No.
Not sure.
Yeah, we can see the slide, and Debbie, we didn't hear you yet.
Yes, I can see it.
Oh. Okay. Let me see if I can unmute. No, I'm sorry, Jackie. I'm sorry, Debbie. Okay, well, you know what? We'll come back. That's okay. We'll get there. Yeah. Jackie, if you want to go ahead and start your presentation, that would be great.
Okay. So again, here from Immerman Angels, we are really a peer-to-peer support organization. It's very different than support groups. So, you know, just making sure that people understand our partnership, why we exist, why our mission is important, and how y'all can support that. We love ALA. I'll get a little bit into that in a sec. So let me, there we go. So what is Immerman Angels, right? So you should know that basically we have this vision that cancer is not a solitary experience. Y'all have shared your experience with cancer. I have my experiences, and I know that y'all are here sharing the impact it's had on you every day. That's what we want people to know that are freshly going through this experience, whether they're a fighter, survivor, caregiver, previvor. We want to know that, let them know that there's comfort, there's understanding, all speaking to people that have been there, done that. So y'all are giving back in your ways. Our ways is to like really have these people, this whole organization help facilitate our vision. So as Annette has said, I'm the Director of Programs and Outreach. So why me? Well, I started with Immerman Angels just over 10 years ago. And as pretty much everybody else on this call, been directly impacted by cancer. I lost my mom to lung cancer, so this partnership literally brought me to tears when I first had this opportunity to chat with Annette and the team to just even fathom this possibility of helping people with lung cancer, because I didn't have anybody when I was giving care to my mom, and I wish I would have. And so that's really what like had me start at Immerman, because I knew from losing my mom, my aunt, my grandmother, all to different cancers, that it's not easy to go through. You know, being a caregiver is just an experience that you may never really want to have, but as long as you're part of this group now, right, you want to make it the best possible situation that you can. So turn that negative into something positive. And so I saw Immerman Angels as that opportunity. So I started off as a volunteer. At the time, Immerman was really focused on helping fighters and survivors with cancer. And then when I came on, I was like, listen, let me tell you, it's not easy for caregivers either. So we launched into this whole caregiver thing. And I'll tell you a little bit more about that. But the point is that I fast forwarded to 2019, and I am currently a caregiver to my sister now, who has stage 4 breast. And then literally while I was cold capping her, I received the call from my dermatologist that I had skin cancer. So both personal and professional for sure. In fact, tomorrow I go for my next checkup to make sure that I am still cancer free. So there's that. So that's the kind of the why. It's very strong for me, just so you all understand. Now, where does this Immerman Angels name come from? Because it's kind of a mouthful and makes no sense in one way, but when I explain to you who this guy, Johnny Immerman, is, it will all make sense. So Johnny was 26 years old. He got diagnosed with testicular cancer. He's actually a 2-time testicular cancer survivor, but at 26, having testicular cancer, he had a bazillion. If you ever meet Johnny, you'll understand this. A bazillion friends and family. But he did not have anyone that he could turn to ask, what does the chemo feel like when it goes through your veins? Mom, what's it like to date after cancer? Nope, that wasn't going to work. She's really cute and adorable. I want her to adopt me, but she could not answer that question. So he really wanted somebody he could talk to that understood what he was going through because they had been there, done that, and could shed some light and understanding on what was happening. So in 2003, from his hospital bed, he basically decided, I'm going to get up and I'm going to walk around and I'm going to talk to other people that are here and I'm going to find out what they're going through. So aging this, he went in his BlackBerry and started typing in names and what they were going through. And that's really how Immerman was born. We became a actual 501(c)(3) in 2006. And I'll give you a little bit more shortly. But the point is that, you all know that when somebody gets diagnosed, their brain is like going crazy. When you're a caregiver, you're like, oh my gosh, where do we begin, right? Because we know as caregivers that your life doesn't stop, but now you're taking on this other person's treatments and their life and caring for them. So now you're juggling, right? So that's where, these questions, these difficult thoughts can get addressed, is because Immerman Angels gives you someone that you can talk to that understands because they've already gone through it. So really they're like this cancer confidant, really to shed some light and understanding about what you're about to go through. You can have doctors and they're going to say, sure, that's what's going to happen. You're going to have X side effects, right? But they're not going to be able to tell you the actual feelings of how it feels to go through this. So you have this person that gets connected to you on a one-on-one emotional basis. Remember that guy, Johnny Emmerman? He could have used a 26-year-old going through testicular cancer to talk to about what is it going to be like to date after cancer. So that's where Immerman comes in. We basically pair you up with your peer that is as close to your experience as possible. It's not a 26-year-old male going through testicular with a 60-year-old going through testicular. That's not what we do. It's let's give somebody right around that age, right around that experience, right, like around the same treatments, how did they deal with it? And here are some tips and tricks that they can share with you to really give you that understanding. So what is a mentor angel? This is this person that we're connecting our people looking for support to volunteers who are helping. They are that cancer confidant. They are that person that's been there, done that. They are that person that would like to throw that life vest back and say, I've been here, I've gone through this, and this is what I'd like to show. Turning that negative into something hopefully more positive. So that's a mentor angel. So how does this all work, right? So people can come to us different ways. They can call us, they can go to the website, they can fill out paper registrations. For ALA, we actually have our own little system. It's kind of like an Excel spreadsheet, but the point is that you can direct people that you all know through the ALA website and they can get to us. Or they can go right to our website too, but it's better if they go through the ALA in this situation so we can track it better and report back and tell you all what the great benefits are of this partnership, right? So when we get a hold of these people and they've registered with us, we do an assessment. We figure out, are they needing support? Are we the right service for them? What other needs do they have? And also potentially, are they available emotionally to become a mentor? So depending on how they're coming to us, we are doing this assessment and we're figuring this all out. Once we figure out where they belong in our system, we'll go ahead and get them either trained or connected. So we do this with this process that we've had into play. So obviously we're about 16 years old now. We just celebrated our 16th birthday. And we always make sure that we tell both mentor and mentee, listen, we are here. Just give us a call if you need additional support. We are here. Let us know. So basically, we're hearing what's most important to them. And we're figuring out, okay, Now we understand for a support seeker what it is they're looking for a mentor. And then we go ahead and look in our database and we see who matches the criteria of which the support seeker just asked, or this mentor's come to us. This is the criteria that they've experienced. Now, who would they be a good mentor for? On both sides, when we do match, we send out a survey. It's about a month out, and we see, you know, how's this match going? What's it look like? Do you need any other additional support? And they will respond. But again, we always tell them, listen, we're here. You can reach out before that. If something goes awry, if your treatment plan changes, if your diagnosis changes, whatever the case may be. We also tell people that they are more than just their cancer diagnosis. So you'd be surprised at how many people don't care what type of cancer somebody gets diagnosed with. They just want another person going through cancer who also is going through divorce, or somebody in college who had to drop out because of their cancer, somebody that lost their mobility because of cancer. So because we believe that you're more than your cancer diagnosis, we also match on these things as well. So about these mentor angels, I don't want you to think we just let them loose. There is actually a training that we put into play. We do tell them that obviously the bulk of their training is their personal experience. We cannot, nor would I want to, train everybody on that, right? So they share what they've experienced. They also get the Mentor Angel Guidebook and a video, which is interactive, has these quizzes in it. In order to get certified as a Mentor Angel, they have to pass these quizzes, but then they get an awesome certificate at the end that they can print and put on their fireplace. We love it. So a little bit about the numbers, because everybody loves numbers and knowing what it looks like. So as I said, 16 years, we do match more than lung cancer. We're at over 146 different cancer types, and our top are breast, blood, gastro, and head and neck. Now, these mentor angels that I talked about, we have had over 13,000 mentors register with us over all time. Sounds amazing. That number always gets people, but it's not enough. When you think about how many people get diagnosed, you have to think about the diagnosed person and their caregivers. And we are matching on all of this. You have to think about how many people come to us with stage 4, and they may no longer be here, right? You have to think about the psychology behind all of this. I'll have to say, from what we see, a lot of times people get diagnosed with stage 1 or stage 0 or even stage 2. That we don't see as much as we do 3 and 4. This is when people are like, I absolutely cannot take this on by myself. I absolutely need that support. So I wanted you all to understand that that's where we really need mentors, right? Because we always need to add the gas, mentors, to our mission, our car, and fulfill this, right? So always asking for more mentors. So everybody on this call, if you're not a mentor angel for us, I am please, please, please asking you to join us as a mentor, because I want everybody to understand that no matter what your experience is, it is not too little for our network. People ask for things you just wouldn't even believe, and it's not our job to judge it. It's our job to supply that support. So I beg of all of you, we do not drive you nuts. We will only reach out to you when there's a perfect match, and you can also decline. So if you're moving, if you're going to be on vacation, whatever the case is, and you feel like you can't support, you know, you can always decline, and we'll reach out to you the next time. So that's my plea. The other important thing to know is that we're in 113 countries, pretty massive. And we've connected over, this number is not even up to date. We're right at 34,000. So can't keep up with that. So that's a good thing. And also I wish we, didn't have to connect anybody, but that's not realistic. So we want to keep helping people while they need it. So as Annette said, American Lung and Immerman have been official partners since 2019. Just to show a little bit more, we do have other partners that we work with. So we're connecting people all over the place on all different conditions. It's not even just like talking about their diagnosis, as I mentioned. We even have people that are like dealing with fertility issues. So we'll connect with partners like that. So we're always looking for more opportunities to help everybody impacted by cancer. So this is just a way for y'all to get more information. These QR codes are everywhere in case you haven't noticed. But the nice thing is you should be able to hover over it with your mobile phone right now if you are interested and get right to our website there. But I also would love to know who has questions for me. Thank you so much for your time.
Jackie, thank you so much for taking your time to give us all these great updates. I'm sorry, let me just see. I want to mute. One sec to stop the echo. Is that better?
Yeah.
Okay. But thank you, and thank you for sharing your personal journey with us, Jackie. And we are keeping you in our thoughts and prayers that your scan comes back good, and we're thinking about you. So thank you. Anyone have any questions for Jackie?
I would like to say something, if you don't mind. Jackie, thank you very much. I am a mentor angel as well. Have been for, I don't know, 2 years or something. I have had 2 mentees, and I think it's a great experience. Unfortunately, they have both lost their spouses, but helped them through the whole journey with them. So I would suggest that if you aren't part of it, that it's not only helpful for them, it's probably helpful for you as well as you walk through that. So so thank you, Jackie, for the opportunity to be a mentor angel, and Annette for introducing me to the program as well. Thank you.
Thank you, Jay.
Yeah, that's awesome. Thank you.
Alicia, I see you have your hand up. Oh, wait, hold on one second. Can you hear us, Alicia?
IT is not our friend today.
It is not. It is not.
Can I just, Jay, I also want to thank you for saying that, because that is something too that I feel like we don't highlight, me specifically, and should, is that being a mentor, you get so much out of it. Because I think, this is my experience anyway, is that when you go through your experiences with cancer, you don't have time to think about it. You just need to do it, right? So you don't have time to process anything that's going on. You just kind of push it down, and then it's there, right? And you move on to the next day because you have to move on. You have to move forward. This is as a survivor or a caregiver. You just have to move to the next thing and get it done. When you become a mentor, it gives you the opportunity to process what you went through in a whole different light, specifically because you're helping someone else, right? So then you're like, yeah, I went through that too. Wow. Like for me, I was like, kind of a rock star, and like really was able to focus on everything that I was able to do and get done and feel comfortable with what I had done. But at the time, you can't do that. You're so busy being in the moment. So thank you for saying that, because I do think it's very therapeutic for the mentors as well. And again, I appreciate you greatly for being a mentor of ours, because we need everyone we can get.
Yeah, absolutely. Thank you.
Alicia.
Maybe do we have a chat on this?
We do have a chat. Wait, let me just say it. Alicia, now try.
I was thinking maybe she could chat her message.
Oh.
There, let me see it now.
And,
Is that working?
oh.
Go ahead, Bernard. Yeah, let's see.
Yeah, until we can get Alicia on, I'd just like to say, Jackie, you're doing an amazing job. What you're doing, I mean, your story is just so impactful and so relative to everybody here. And I'm sorry for your condolences, and I wish you the best with your what you're going to go through. And I will consider becoming a mentor.
Yay, thank
And
you.
my story is kind of unique to me because it was I didn't have a chance to take care of my mom because it was like 3 weeks after she was diagnosed, she passed away. But it's all that emotional things that you go through during that time frame to try and put everything together. Like, why did this happen? How did this happen? It came so sudden. We seen signs, but it was something that she was trying to protect herself from me. So she didn't want me to know that she was going through it. I understood that. And from that, I was able to turn my pain into purpose. And that's how I became an author, and writing a book, inspirational, motivational poetry book because of her. She used to always tell me, son, and Annette, and I'm sure you probably heard the story before. Annette heard it 1,000 times, but I'll say 1,001. She used to always tell me, son, I don't worry about you because you are. So, that Sunday after I buried her that Saturday, something in my spirit said, know who you are. And I got up and wrote a poem, Know Who You Are. And that's how everything started to transpire from that. And I read the poem to my mom, to my family, my wife, my two boys. I said, hey, listen to this poem I wrote. And he said, wow, Dad, that's nice. So every Sunday in dedication to my mom, I write a poem. Next thing you know, I wrote 100 poems. I had never written poetry in my life. So that was just part of my journey. And that's when I told my wife, I said, I have a gift. So I got to give back because words are powerful. Like you said, people go through these emotions and sometimes, they need somebody to connect to talk to. And just those words can just like take them to another level to just help them get them through the process. And that's when I contacted Annette, the organization, said, hey, this is what I went through and the rest is history. But you're doing a great job. I commend you on that.
Thank you. Oh my gosh, you gave me chills. Your mom must be so proud. That's amazing.
Thanks.
Thank you for doing that
Thank
and
you.
sharing that.
Thanks.
Alicia. I'm so sorry. Alicia, if we still can't hear you, but if you're able to get off mute, I'm gonna let Dan ask if anyone else has any questions or comments, or we're gonna talk a little bit about Debbie. Debbie, I see you.
Can you hear? Can you
We
hear
can.
me?
We've got
Hey.
Houston. We've got contact.
So I've been an Immerman Angel mentor for probably maybe 5 years.
Yay.
And I love it. The people definitely need what you guys are providing. That's been my goal since I was diagnosed, and I'll just give you a little background since I couldn't talk earlier.
Yeah.
In 2013, I was diagnosed with stage 4 lung cancer. In 1997, my mother died of lung cancer, so I've been both a patient and a caregiver. And they're so completely different that everything that you go through is very legitimate. And sometimes I think a caregiver has a harder time. So to have Immerman Angels where you can match people is just great. That's been my goal since my diagnosis. And that's actually every lung force I've ever done has been Team Pickworth, and our motto is nobody fights alone. So I just want to say thank you for what you guys do.
For sure. Thank you so much for that. And congratulations on your survivorship as well. And thank you for being mentor. I assume you're a mentor on both sides, both as a caregiver and
I've
survivor.
not been on a caregiver side yet, although I'm willing to. But definitely on the patient side. I probably had at least 10 mentees.
See that. Thank you so much. Yeah, it's interesting, like just what you said, right? So like being a survivor and caregiver myself, I also agree with you. Like when I got my diagnosis, I was like, I don't have time for this. Literally that is what I told the doctor. I do not have time for this. I am taking care of my sister. Like this is not okay. And that is a lot to process in itself, right? So like being a caregiver has been so much more challenging. So I would say that that is unfortunately true, but also the other part is that caregivers downplay their experiences a lot. But we all know that if you don't take in that self-care for yourself, you're not the strongest person for the people you're caring for. This almost is a method for self-care, you know, and so you becoming a caregiver mentor could really help you in ways that you're not even imagining. Because again, to Jay's point, it's very therapeutic, you know, as a survivor, but I don't know that you know that as a caregiver. And so what happens is we have so many people that actually request support as caregivers. We do not have so many people that become mentors as caregivers. So we have this lopsided situation going on constantly. And, you know, I know from the partnership that I'm always reaching out. They're probably sick of me. But I'm always like, can you give me more mentors, please? Because we don't, unfortunately, we don't always have what we need at the time that we need it. So then we over here are scrambling. Like I've literally been on, we have a whole new volunteer situation where they're called stalkers. Or AKA targeted outreach, where we're hashtagging people on social media to find mentors that fit the needs that we need at that time. So anyway, all that to say is please consider also becoming a caregiver mentor and spread the word to all the people you know. I know y'all know people, so we need it.
So Jackie, thank you. We definitely, I think November, in addition to being Lung Cancer Awareness Month and COPD Awareness Month, I believe it is Caregiver Awareness Month.
That is correct.
So we can definitely help, you know, reverberate that message and call out. Yeah. I mean, that was the other thing I was going to ask is, in addition to caregivers, are there other mentors or mentees that you need? Any other specific group? I know caregivers is a continuum, but any other groups?
Yeah, stage 4.
Okay.
Stage 3, stage 4. You know, as we all know, the pandemic caused a big situation in medical care, a lag in people getting diagnosed. So here we are, like slapped in the face with a ton of people that have been diagnosed with stage 3, stage 4, whatever the cancer is, looking for support, and their caregivers as well. But the pandemic also played a major role in everybody's mental status, right? So I don't know if you all have heard of the spoon theory, but if not, check that out. Spoon theory is happening over here. So we have mentors that are at their bandwidth. They have no more spoons to give. And so they may be a mentor angel, but as I told you, they can say no. So we're reaching out to our over 13,000 mentors and we're asking, can you be a mentor at this time? And they're saying no, because at this point, I just don't have the capacity mentally to do anything else than what I am already doing. So not only do we have that going on, but then we also have people that are like, listen, I don't want to go ahead and sign up to do one more thing. So typically by now I have about 800 new mentors. I literally just ran the report because we're having our staff meeting later today. 461 new mentors this year. That is almost half of our normal, like, incoming mentors. So we see it, but guess what? Our mission hasn't stopped. In fact, our mission is growing, but guess what? As the support seekers only. So that's where I need all of you all to like spread the word and tell people about us, because again, to Jay's point, it's therapeutic, it's beneficial for them as well. No experience is too small. We need everybody to help. If you've gone through this, share some light, share some understanding, share some comfort. You will benefit someone at some point in time. The other thing I like to tell people is you know, sometimes you don't get called. I'm glad that you two got called, that you are mentors and you have gotten called. We do have some people that it takes a while to get matched, and they're like, listen, I signed up and I'm not matched yet. I'm like, trust me, it will happen at some point. But to not have you, that's where it comes into being a problem, you know? I'd rather have you than not have you, kind of thing. So yeah.
Thank you. Thanks, Jackie. Alicia, we'll try one more time. Or if not, like as we mentioned, if you want to put your in the chat box, which is at the top of the screen, it's the little bubble with two lines in it. If you're not able to get your audio, if you want to put any of your comments in the chat box, we'd be happy to circle back with you. But okay. Well, the two things, I know we have a lot to talk about today. Again, if anybody has anything that they want to say, and I'm talking, just interrupt me, put your hand up. But the next thing that I wanted to touch on was Dan Jason is going to talk about, as we said, November is Lung Cancer Awareness Month, and Dan's just going to give a little bit of insight on the things that we're doing with ALA.
Yeah, absolutely. Thanks, Annette, and thanks so much, Jackie, for being here today. And we're obviously just a few days away from Lung Cancer Awareness Month, which is a huge month for the Lung Association and for the lung cancer community at large. So we want to really make sure that this year, as always, that your stories are front and center. So we are, you know, telling our Lung Force hero stories throughout the year, but especially during November, highlighting, you know, the inspirational stories that really drive our mission forward. So, you know, hearing Debbie's story of surviving 10 years, like that is so exciting. And I know Bernard, you and Debbie have both, you know, attended Advocacy Day in the past. We're really doing everything we can to continue, you know, our legacy of supporting patients, caregivers. We have a lot of new resources that are coming out during November. So our lung.org/lung cancer page, we'll have a lot of those. And we will also have a focus on lung cancer screening throughout the month. We know that this is a huge opportunity, certainly to save lives. And our State of Lung Cancer report, which is coming out on the 15th, will really do a great job of kind of highlighting the need and the opportunity there. That report that I just mentioned, State of Lung Cancer, it's also really a rallying point for our activities throughout the year. So this gives us a chance to really demonstrate the need and the burden of this disease, which we all know so well, throughout the country, and hopefully get some media attention on that. That is something that has really been, you know, an important part of our outreach in the past several years, is just, you know, underscoring the need, but also showing that there is hope. We know, for instance, the survival rate continues to go up. We know that the investments in treatment that, you know, all of the lung cancer organizations and pharmaceutical companies are making has really paid off. So, you know, all of these things together really get us closer towards, you know, a world where less people are, you know, impacted by this disease. So feel free to, you know, share any of our Lung Force social posts throughout the month. Share your own story on social media. It doesn't matter if you are, you know, tagging the Lung Association. I think that, you know, just having those personal stories goes such a long way as we look to kind of raise awareness and defeat the stigma that we know is so prevalent, unfortunately.
Thank you, Dan.
Of course.
Alicia, I think she said, okay, that was Debbie who said it to Alicia. That's good advice. Okay. Again, if anyone wants to have any questions for Dan, I did put in the chat, which I had met out to the group, our lung cam engagement guide that kind of gives you some of the ideas that Dan mentioned. So that is in the chat. And after this call, I will send a follow-up, because we're not going to cover all the things that we want to talk about today. And I'm also going to give you a survey link to help me do some work on our Courage kit. So I will send that out in a follow-up email. I am going to briefly share my screen. So another cool thing that we talked about was the asking the advisory groups, like, what do you see that you want to happen? Hold on, let me put this. Does that show full screen now? You see full screen, or do you see the
Yes, I can see
okay,
it.
great, thank you. One of the things that came out of these groups is that, you know, we heard from folks that there was not a lot of support, in addition to the critical support that Immerman's Angels provides with the one-on-one. There was a need that some people felt like that they would go on any street corner and they could find support groups for a lot of different things, but there was not a lot of lung cancer support groups. And so we had a very generous family foundation in the state of Nevada, who he lost his mother to lung cancer and 2 other of his family members to cancer. And he himself struggles with asthma. So he partnered with the Lung Association, and we got this lovely gift in the state of Nevada to create a lung cancer support group model and also the Courage Kit model. And when I say model, I'm doing air quotes around that because we, as with any program that you have, you need to have, guidance and supporting documents. And so we were able to use this donation. While the support group is just going to start in the state of Nevada, we're hoping to branch it out and to go into other states. So you all have been very helpful with looking at some of the materials that I've provided. And but I just wanted to kind of circle back and let you know more to come, that they are going to be launching. We're hoping to launch the support groups in 2023. And the goal of that would be to work with the hospital system or a local place where we would train facilitators to come in and to do support groups. So here's kind of the interactive part that I'd love to hear from you all. When we create these facilitator guides, we want to give them guidance on what to talk about, so that, of course, it's interesting and relevant. These are some of the topics that have been provided in the past. And as I mentioned, I'm going to send these to you in an email. And if there's anything else that you could think of, we kind of have these dated by months, but if there's anything else that you can think of, I'd love your feedback because it definitely is very helpful. We will integrate that into the choices because the facilitators would have the choice to pick different topic areas, but we want to make sure that it's relevant, timely, and important to lung cancer patients and caregivers. So as you can see on the screen, we're looking at exercise in lung cancer. February was intimacy relationships post lung cancer diagnosis. In March, how to get involved in advocacy. A lot of that is because we do, the Lung Association and many public health organizations do go virtually or in person to Washington, D.C., typically in the March-April timeframe. And, many of us collectively advocate for cancer research funding. So that's kind of where we used a topic for that. April, nutrition and lung cancer. May, we grant lung cancer research to researchers. And we thought that it might be kind of a cool thing that in the state of Nevada or wherever this support group is to maybe spotlight a local researcher that's doing lung cancer and inviting that researcher to come. So any thoughts on the first 5 months that I've talked about? And again, I know I'm putting you on the spot now and you're going to have a chance to submit more later, but from like January to May, those were some of the topics that we were putting out there for discussions. Any thoughts, good, bad, indifferent?
Annette?
Yeah.
It's Jackie. I don't know if you can see me. I know you have the
Yes.
screen here. But can you please send me this stuff? Because we have a partnership with Nevada Cancer Coalition, which covers the whole state of Nevada. And so they would probably really love this information.
Yep.
So if you could send that to me, plus we have our resource packet that goes out currently every month, and that goes out to over 40,000 people. So I would love to insert these events into that for you guys. Okay.
And then we also have, like, as Dan mentioned, we've got some new exciting lung cancer resources that are going to be launched in November and early 2023. We'll make sure that we get those new updated resources for you. So
yeah, that would be great. Thank you.
Mm-hmm.
One of the things that you might want to add to that is some kind of information on pulmonary rehab.
Mm-hmm. Really good suggestion.
I don't understand why that ain't part of any lung cancer diagnosis treatment plan. It took me 6 months to get into any kind of pulmonary rehab after radiation. I still am floored by it. So something on that would be fantastic.
That is actually really good. That is a really good point, Debbie. And, I think, again, this is why this group is invaluable, because, I think that's a great recommendation, not only for this, but for some of the work that we're doing is really talking. Now, the Lung Association does have, for over 50 years now, we have the Better Breathers Clubs. The Better Breathers Clubs are for lung disease. A lot of lung cancer patients said that, or caregivers said that they didn't necessarily find a lot of value in going to these clubs because they talked a lot about COPD and asthma, not specifically on lung cancer. But I do believe that we can definitely loop in if the Better Breathers Club, I would hope they talk about pulmonary rehab. I'm sure that they do. No, I'm sure that they do, but we can, because I think that's a really good recommendation, Debbie. Thank you. Okay. And I'm going to send this out to you in a form that you can be, take your time and think about it. And again, it's an ongoing thing because we have not launched this. We're hoping to launch it at the end of, in November, but we definitely have the ability to add things to the menu of choices and programming. The other thing that,
sorry.
Yeah. Yeah.
What we, because obviously this is emotional support that we get. So people are always asking about the conversation between being diagnosed because you were a smoker or not, right? So that is something that we deal with a lot of times. So I don't know if that would be of interest to you. The other conversation that comes up a lot is targeted therapies and having those mutations versus like not knowing what even a mutation is. And so those conversations could be beneficial as well.
Absolutely.
So that was just my tidbit.
Perfect. That's very helpful. Thank you. That's very good.
Annette, what about someone to speak on the new technologies, the new medicines, anything like that? The findings that they're the latest on lung cancer. Do you have anything like that where someone could really speak on that, like in terms of the research and development that they've been doing, and how they're progressing?
I think that's a great suggestion. I think that we can drill it down a little bit more. I think with the researcher, we could add more to that program. But no, I think that's a great suggestion because there are a lot of, so many more treatments every year are on the market. So I think that's a great suggestion, Bernard. Thank you.
Okay.
The other thing that we wanted to, from feedback from folks is that what you need, and when you create any kind of support group or any kind of gathering of patients and caregivers, like these were some of the things that we've heard from you all, that, it needs to be positive and inviting. And you really need to focus on giving support for somebody processing stressful news, help managing with disease-related anxiety, to help patients and caregivers feel their unique experiences understood. And I think this one was a big one, is really supporting navigating the unknown, because I think what we've heard from so many people that this was so unknown. You just didn't know what to expect, what to do. And that's very scary and overwhelming and isolating. So we definitely are weaving these themes into how conversations are and resources that we're providing. So, and also the final and most important one is to support loved ones through a crisis. We are not only through the topics of our support groups, but these are really good things that we're going to create materials, create programs outside of a support group, something that could be a nationwide webinar or, a program in a certain area on these topics, because they are very, these themes were very relevant and very important that you may not necessarily get through your lung cancer diagnosis or your treatment. You're talking about anxiety and supporting each other through stressful times. Like these are very critical, the mental health piece of it that we want to take into consideration. So wanted to let you know the thought that we were putting behind this, and it is a ever-going process that we're working on, and we absolutely value your insights and your input throughout this. I mean, while we may not meet every month, I do see when we're really launching, getting this underground, that I will be communicating with you, and all my communication is optional. If there are things that you have time to review, wonderful. If you don't, we can hit you next month. But super excited because I felt like we just needed this little bump over, like my department needed this bump to do this direct patient service program. While we do a tremendous amount of work in lung disease space and support, these were the two things that we've really been advocating for many years, and just super excited that we're able to kind of start nudging in that direction to do this one-on-one support. So more to come on that. The other piece of this is that the courage kits. And I remember it was Denise Lee who was diagnosed in California, and Denise said that her nurse navigator felt badly for her, and she gave her the breast cancer awareness bag, because there was always an abundance of other bags. Not that you need something, but it was comforting and making people feel supported at the time of their diagnosis. And so this was something that we've done on a very, very limited scale of pilots of different areas. And again, this was picked up in Nevada, which we're super excited about. And really the genesis behind this is to, number one, when you get your diagnosis or your loved one gets a diagnosis, it's very confusing and overwhelming. And I remember someone said that they got a folder with all these white pieces of paper, and they just didn't know where to start, where to look. And so we've created this guide that kind of is from diagnosis to treatment to survivorship, to kind of give you everything that you may need, a majority of things that you may need in one location. So that the resource guide is the one piece that is part of this. But then in addition, it were things that people said, when they were going through their treatments, that, their feet get cold and their heads get cold, and water, a water bottle, everything from they're there for several hours, and then the adult coloring book with the pencils. So things that you all have provided your insights to, we have this now. And again, the genesis of the creation of this is to provide to newly diagnosed patients, or really any patient during during their diagnosis, but to work with hospital systems. So if it's the nurse navigator, or if it's an existing support group or an existing gathering, like Debbie, I know said you're very involved with the support group in your area. There could be other support groups that are cancer related that may have a few lung cancer patients. We really want to branch out and try to provide this to as many patients as we can. And as I said, right now we're just in Nevada, but it just is an opportunity to let lung cancer patients know that they're supported, and that we're here to help them in any way we can. So that's kind of the initial thoughts on the Courage Kit. Now, this is another thing that I'm going to send to you as a follow-up, because I know on the spot it's hard. We are going to launch in Nevada when the Courage Kit items are available. We're going to actually meet with the local leadership board in Nevada, and get together, and we're gonna stuff some packets. But one of the things that you guys recommended, I think 2 or 3 years ago, is handwritten notes. And now you wouldn't be able to personalize them as in Dear John, but you would be able to personalize them as in a caregiver, a lung cancer patient. And what we really would love to talk about, or for you to give some thought around, is what do you think would be meaningful and insightful for lung cancer patients when they would get this care package? What kind of a note would be helpful to them? I also am going to give the folks, like the process for this is I would probably give blank note cards. And so anyone who wants to write notes, we would send you the note cards, and then you would, and with a self-addressed and stamped envelope to send back to me, and then we would give it to our printer, and they would be included in the packets. But for the conversations today, like what types of things would be meaningful or thoughtful to put into a packet that a lung cancer patient would get? And again, I'll open it up now, but again, I will give you a chance after the call to give me more insight. But
Is your question, sorry, maybe I just missed the question. Was your question concerning the handwritten note or that overall caregiver packet that you just talked about previous to this slide?
But well, both. But I think that I was trying to get your feedback on what you thought would be a meaningful message that people could write into notes to put into the care packets.
Okay. Yeah, like I said, I just missed it. Because what I was thinking on the other thing, you had that notebook.
Yep.
And there's always a list of questions that they don't have a clue what to ask.
Yep.
And it's like, could they have like a pre-printed list of questions that they can ask in that notebook that's given to them? So it helps them kind of organize, what should I be asking the doctor, or who should I be doing this? That kind of stuff.
Yes.
Yeah. So
that is actually,
anyway.
no, that's a great, I'm glad you said that. So I will upload in the chat when actually I can stop sharing my screen. I'll share the guide, and that's kind of what it is like the questions to ask your doctor, some suggested questions to ask your doctor, things to be, thinking about, the biomarker testing. It has from A to Z of things to do, but in that guide, that's where we have the questions. The journal that the book right here was, this item right here was for people to journal, because we heard from folks that was very therapeutic to do their journaling, to talk about what they were feeling. But this book right here, this does have new questions to ask your doctor.
Okay, great. No, that's great.
The other thing I'm thinking, because we hear this all the time, is surgery needs. After you have a lobectomy, what do I need to make sure that I'm comfortable, or what will my loved one need to make sure that they're comfortable? So what should I have prepared? Like a prepared list for surgery, for radiation, for chemo, which I can add in there too. A little plug again for Immerman. Sorry, but I kind of like them. But Immerman Angels gives lemon heads out for free. We would 1,000% ship you, so that if people have that yucky metallic taste, we can supply you with that.
So Jackie, here's my official request. I haven't sent you the email yet. I'll send you the address of the vendor like you did before, because I would love for you to ship them some, and they'll put it inside the packets. So here's my official ask. So yes, please, and I'll send you the address.
Thank you. And also, can I get one of those kits to have on hand, so that way when we talk to people, we can say you should reach out to ALA for this reason,
Yes, so for absolutely, right now, because it's in Nevada, but we're on the tips of, and that's kind of, with public health, when you work on grants, we have to keep the grant money, but we are hoping to have it nationwide. So I definitely could, we're hoping to help do that, but not yet. But right now we're just in Nevada. So.
Annette, what about inspirational quotes? Sometimes people just can't find the words, but sometimes a quote, is very powerful. They read that and wow, this really what I needed today. You know what I'm saying? So what about including something like that in the package? Absolutely.
That's a great suggestion, Bernard. I know if I get out my book from Bernard, I bet you I can find some in there.
You're right.
I know that I can.
You're right. I got one that says, I have a saying that says, life is not about learning how, life is not about waiting for the storm to pass. It's about learning how to dance in the rain. And see, a lot of times people, they're going through these storms and they're trying to find a way through it. And they just got to get through that whole process and, what they're going through. So it's a storm that's in their life right now, but you got to learn how to dance and how to move in that so you can get through it, so you can grow through it. So those are just some, that just came to my mind just now when I said that.
Love it.
So yeah, I agree. I actually got a quote tattooed on my arm when I got cancer, and it says, "I was given this life because I am strong enough to handle it." And then I got another one that I put on the back of my cards that I hand patients. And it says, "You are braver than you believe, stronger than you seem, smarter than you think, and twice as beautiful as you've ever imagined." Wow. So, and people really, really like that. So the other thing I was going to say is the handwritten notes. I absolutely love that. They're not even handwritten. When our cancer center before COVID, I'm going to say pre-COVID,
Mhm.
they had in the radiation where you go get your scans and stuff in the radiation area, they had a book where cancer patients, while they're waiting to be called back, could write their thoughts and other people can come in and read.
Oh, wow.
So if you can get a bunch of like little letters like that and put it in a book to put in that bag.
Wow. That just
Yeah.
gave me chills, Debbie.
Yeah.
Even quotes, just little quotes, just things like that and other people's stories in a book that you give, because I can't see anything else that has more hope is
Yes.
someone who can give you the story. So
That's amazing. That's amazing.
my thought.
Now, and you know what? I just had a thought too of, I know we can't necessarily mail, it's great mailing, but this could be a good mechanism too, that, a monthly quote of inspiration, quotes of hope,
Yeah.
or something like
That's
that.
what I
That's
was
just
thinking
that
of.
too. Yep.
Yep.
Yep. I love that.
We have a net to this organization. It's Ignite Hope. I literally have it burning right now. I don't know if you can see. Made by
Yeah.
survivor, cancer survivor. And inside here, to Bernard's point, is metallic scrolls. And you never know how many are in there, but they are inspirational messages. So as you burn them, you will get, it's so fun because you're like, I wonder how many's in this candle. And so then you take them out and then there are these quotes. So I'm waiting to see what my messages are in that one. But
Yeah.
anyway, that's another nonprofit that I could hook you up with if you were interested in that. So
That's great. Hey, guys, I
Awesome.
have to jump off. I'm sorry, I have another meeting. I'm very sorry.
Thank you so much, Jay. Thank you. And we will be in touch. Thank you so much.
Bye-bye.
See you, Jay. Take care.
Yeah, Jackie, I love that. I will say that sometimes we definitely, although I do have a candle burning as well, I think sometimes when people have respiratory issues, in addition, that burning candles sometimes are an adjutant or irritant, I should say.
yeah.
But I love the idea. I love the idea. I love that. I think that's very cool. But okay, so but I will, to this group, send this information out. And this is the kind of stuff that we love talking to you about, and really your input and your advice, it does matter to us. You've definitely helped direct and navigate so much of the work that my team is able to do by giving us your feedback and your thoughts. I know we're close to the hour. The only thing that I would just run through quickly is, we do a big push every year with millions of Americans due to their pandemic have lost their employer-based healthcare. And, open enrollment is so critical for lung disease patients. And it's sort of, a cumbersome process. The Lung Association, we've spent quite a bit of time and energy on putting together, easy how to navigate the healthcare.gov. And so we have these open enrollment resources that I will share with everybody. I have on a note, I just want to share this one video. John is one of our Lung Force heroes from Chicago. And these are the types of things that we like to try to, really give more of a personal touch of why this is so important, because healthcare, you can't live without it. And so many millions of Americans are struggling with it. And especially when you have, lung cancer, it's so important. So I need to stop sharing. I'm going to show John's video and then I will let everybody. I appreciate you spending some extra time with me. Okay, audio. Whoops. Oh, wait, I'm sorry. This is so clunky. And so let me see. I hope you can hear it.
Of course, it hit me hard. My wife had just lost her mom like a couple years before from lung cancer. My auntie died from cancer, so it was rough on us. And honestly, I didn't know what to do. It just put me in a place where I was discombobulated, scared, I'm uneasy, proud that I'm gonna make it, because of God. But it was hard, and it was hard on my family. I went in for my shoulder, and come to find out, when I did a CT scan, I had a lump the size of a tennis ball in my left lung. Having health insurance, I think, really saved my life because my cancer was so aggressive. The advice I would give people who are looking for healthcare coverage and quality healthcare coverage: don't be dismayed or disheartened because the first time it's kind of difficult, confusing, the lingo, what do you have to go through, paperwork. Just keep trying, reach out to your local clinic, talk to a family member that's been through something heavy in the hospital. They would know because of what they've been through. But just don't give up. I think about how scared I was in that office, waiting on the diagnosis on the table, getting poked at, getting cut up, and it's hard. I just want people to know that get some health insurance. I don't care how you do it, and it's out there. Don't be afraid, especially people of color and people that have been dealing with inequities. Help, help is out there. Just don't be afraid.
So these are just some of the resources that we have, because it's just in the continuum, if I can get this on my screen, in the continuum of care. I mean, that is one of the things that we're so proud of, the work that we do of really addressing, access to quality and affordable health care for all Americans. So that's another important initiative. And again, all these things are available to you, and we'll share. Well, if you see them, we'd love for you to share them on your social media or share them with your friends. And hopefully it will help people this time around when open enrollment kicks off in November. So anybody have, Andy, any questions from you? I see your mute button. I don't know if if you wanted to, I feel bad you haven't had a chance to say anything. You don't have to say anything, but I wanted to welcome you to the group, and we appreciate you spending some time with us today.
No, I'm excited to be here. I'm kind of unique like you guys too. I'm a cancer survivor and then also a caregiver. So this Emmerman Angels looks like a great program. And so I'm just kind of listening from my first, meeting, but I do look forward to being involved more. So I'm very excited.
Well, thank you so much. Alicia, hon, I'm sorry we can't hear you. I hope that you're having a good day in sunny California. But everyone, thank you so much for your time. We will be sending information out for you to become, to give us your feedback on the support group and the Courage Kits. And again, this is the type of work that we've done collaboratively. So thank you for your continued sticking with us and doing these programs. So have a great day, everyone.
All right, thanks, everybody.
You too.
Thank you.
Bye-bye.
Take care.
Thank you.
Bye. Bye.